Welcome back to Hometown Health, serving Lake County and the Villages. In for Mark Roberts this month, I'm Michelle Wargo.
And I'm Beverly Onstead in Studio H at Lake Sumter Community College.
As we mentioned earlier in the show, this month we're paying particular attention to men's health, starting with National Men's Health Week, June 11th through the 18th. The purpose of Men's Health Week is to heighten the awareness of preventable health problems and encourage early detection and treatment of disease among men and boys. According to the CDC, heart disease is the #1 killer among men in the United States. Several medical conditions and lifestyle choices can put men at a higher risk for heart disease, including high blood pressure, high cholesterol, diabetes, smoking, being overweight or obese, having a poor diet, low physical activity, and drinking alcohol. The specialists at Florida Hospital Waterman's Heart Center explain that 9 out of 10 heart disease patients have at least one of those risk factors.
The 7 most important risk factors that we look for cardiac disease are family history, age, exercise, diet, blood pressure, smoking history, and diabetes. Diabetes is a pervasive, what we call vascular disease, and it works on the small blood vessels anywhere in the body, the heart being one of them. And we've certainly found that getting more towards a normal body weight, exercise program, and glucose management reduces those risks. The origin of male versus female heart disease is for the same part coronary artery blockages. That's typically what we think of when we think of cardiac disease. And that disease process is really similar males versus females. The two differences that we've come to observe, one is an anatomic issue and one is sort of a social issue. Simply on the anatomic side is even for what we call age-matched controls. So male, female, same age, relatively the same body size. Females tend to have smaller arteries and they tend to block a little bit earlier in their course. On the other hand, there's behavioral and social issues. Men tend to be more sensitized to cardiac disease, so when they either experience chest pain or they communicate to their social network or their spouse that they're having chest pain, people tend to have heart disease higher on that alert list, as opposed to when females describe it, it tends to be described away as anxiety, indigestion, nerves. Growing up, I was always taught, as were many, both in school as well as all the way up through medical school, for example, that blood pressure of 120/80 was quote-unquote normal blood pressure. Interestingly, when you take a look at blood pressure and what are the effects of incremental increases in blood pressure, if you go from 120/80 and you go up by an increment of 20/10, so in other words, you go from 120/80 to 140/90, that increases your what we call all-cause risk of cardiac disease. That could be stroke, that could be kidney disease, that could be heart disease. It increases your risk by 100%, just something as simple as that.
Some simple steps may help the men in your life prevent heart attacks. The American Heart Association and the CDC recommend at least 10 minutes of brisk exercise daily to reduce your risk of heart attack by 50%. And if you can increase that to 30 minutes a day, you will decrease your risk of heart attack by as much as 75%. You'll find more information about the staff and procedures offered at the Waterman Heart Center when you click the Men with Healthy Hearts story link on our homepage at yourhometownhealth.com. Speaking of Florida Hospital Waterman's Heart Center, Hometown Health was on hand as a media sponsor for their annual gala event. We'll have highlights and interviews coming up later in the show.